Welcome to video series on acid-base balance. Now this is the last video on acid-base balance. This video mainly deals with how to identify different acid-base disorders, which is the primary one and which is the secondary one, and whether this disorder is a compensated one or on the uncompensated. So let's consider these different examples. Now in the first scenario, the pH is decreased, so it is acidosis. The bicarbonate is decreased, so it is metabolic, because bicarbonate is a metabolic component. Because partial pressure of carbon dioxide is normal, so it is uncompensated metabolic acidosis. So in the next scenario, pH is decreased, the bicarbonate is decreased, and partial pressure of carbon dioxide also decreases. Now this decrease is because of hyperventilation or the small breathing. Now when all the three parameters are decreased, pH is decreased, bicarbonate is decreased, and partial pressure of carbon dioxide is decreased, it is said to be partially compensated metabolic alkalosis. When the pH gets back to normal, then it is said to be fully compensated metabolic acidosis. Let's consider now metabolic alkalosis. Now in alkalosis, pH is increased because bicarbonate is increased, so it is metabolic alkalosis. As partial pressure of carbon dioxide is normal, it is uncompensated metabolic alkalosis. Now, so when the partial pressure of carbon dioxide also increases, now this increase is because of hypoventilation. Decreased ventilation, carbon dioxide accumulates in the lung, and this is said to be partially compensated. Now when the pH gets back to normal, then it is said to be fully compensated metabolic alkalosis. Let's consider the third one. When the pH is decreased, it is acidosis. Here the partial pressure of carbon dioxide is increased, so it is respiratory acidosis. Bicarbonate is normal. As there is no change in bicarbonate, it is said to be uncompensated respiratory acidosis. Now we know the compensation involves the counter variable. Counter variable here it is bicarbonate, and it involves in the direction of the primary variable. Primary variable is increased in partial pressure of carbon dioxide, so bicarbonate increases. Now this increase is mainly done by the kidneys by increased reabsorption of bicarbonate at proximal convoluted tubule. So this is said to be partially compensated respiratory acidosis. When the pH gets back to normal, then it is said to be fully compensated respiratory acidosis. Consider the last part. The pH is increased, so it is alkalosis. Partial pressure of carbon dioxide is decreased, so it is respiratory alkalosis. Because bicarbonate is normal, there is no change, it is said to be uncompensated respiratory alkalosis. So when the bicarbonate also decreases, then it is said to be partially compensated. This is because we know bicarbonate is the counter variable here, and the primary variable is partial pressure of carbon dioxide. Partial pressure of carbon dioxide is decreased in respiratory alkalosis. The counter variable bicarbonate also has to decrease. Now this decrease in bicarbonate is done again by the kidneys. Kidneys no longer reabsorb the bicarbonate, and it excrete the bicarbonate, getting back the pH to normal. Then the state is said to be fully compensated one. Now this is how we need to differentiate different acid-base disorders based on checking out for the pH, partial pressure of carbon dioxide, and carbonate. So thank you. This was all about interpretation of different acid-base disorders. Please do like, share and subscribe.